Recording going. All right, so welcome to day 4, our final Zoom day for Adapting for Diversity and Exercise. Again, thanks so much for all of your time and attention throughout this course, guys. I know it's not easy, especially later in the evening, to sit and just listen to me yap away for a couple of hours, but you guys have been awesome and really engaging. So we'll cover a fair bit tonight, starting with chapter 8. And then we're going to go through a really good in-depth review in preparation for the final exam. So starting with ensuring class safety. So your NSFA instructor qualifications as an NSFA fitness instructor with up-to-date, you need your up-to-date CPR and first aid at this. Go ahead, Ocean.
Oh, I just wanted to say you've been awesome too.
Oh, thank you. I appreciate that. Yeah, I hope it's been a
Sure.
decent experience for you guys. I really enjoyed myself with the small group. Thank you. Yeah.
So thank you.
So right now, your CPR needs to be renewed yearly with NSFA. They might be changing that sometime in the future, but at this time it's every year, and that's regardless of the expiry date on your certification. So some last for 3 years. That is not recognized by NSFA. So make sure you get it yearly. Great time to do that is during the what am I trying to say here? The spring event. So when we have our summit meeting, that's the word I was looking for. Our spring summit meeting is a great time to get your CPR. I think it's only like maybe between $10 and $30, and they do it for about an hour or two after all of the courses of the day. So if you do it through somewhere like Red Cross or St. John's Ambulance, it's usually $80 or $90 to recertify, and it takes at least one full entire day. So I'd highly recommend doing it through the NSFA if you're able to. Also, make sure you know the emergency medical system in the area you work in. As we know, for here, it's 911. Have numbers available for ambulance, fire, and police, and also the non-emergency intervention line is a really good one to kind of have on speed dial. So maybe it's not an emergency, but maybe you have someone who's kind of acting erratically and you're concerned for someone's safety, and maybe they need to be removed from the class or from the building. Um, know who to notify at your location, the facility where you're teaching, in the event of an incident. It's a good idea to possibly have copies of incident reports on hand. So if you're working in the facility, make sure you're using the ones that you use. But if it's you as an individual, create some copies of incident reports so that you can have those available just in case something happens in your class. I will mention that's very important for insurance purposes. If someone ends up getting hurt and they don't realize it right away, they have up to 5 days to file an incident report before it's void, and they won't be able to anymore. So make sure that you do it right away. Good rule of thumb is that if someone hits the ground, that is a fall. Okay. If someone stumbles and doesn't hit the ground, as long as they don't hit something else like a wall or a chair, then usually we can, if they say that they haven't had an issue, then we can accept that. But if someone lands on the floor, whether or not they think they have an issue, we always fill out a report. If there's an emergency in class, you have a participant call 911 while you deal with the injured person. Go ahead, Bethany.
If the person says that they're okay, would you recommend still for your own benefit writing? Yeah, because that's what I do in my line of work, like kind of
Yeah.
like just an objective, like this is what happened, and then
Mm-hmm.
initial. So okay,
Absolutely.
so
Yeah. Yep.
even if they say they're okay, okay.
Absolutely. And sometimes, especially if they say they're okay, because not only are people often embarrassed by the situation, they also have their adrenaline running high, which is a painkiller. So they might not even realize that they've possibly even broken a bone until later on. So, absolutely. And you don't have to have any input from them at all. You have your contact information, their name, and just your perspective of the situation. And then if there was a witness, you might want to include that as well. But yeah, they don't have to be involved. And then you have it on hand and you can dispose of it after 6 months to a year if nothing's come up. But yeah, good fail safe. If you are an independent contractor and you rent a space like a church or hall located in a place with no support staff, make sure you have a clear plan and practice with your participants, especially if it's somewhere like a church basement where maybe in a power outage, the elevator might not be working. What's your plan in those situations? Have a list of your participants and medical information for emergency personnel. Make sure you're following the guidelines of confidentiality as well. So we never have files like that open on a computer or or face up on a piece of paper in front of us when there's anybody else around, and we keep them secure. And also have medical information for contacting emergency personnel, such as diabetic. Have a prepared handout for safety rules and copies for new participants. This is really great when you're working with seniors because they can be a little bit forgetful sometimes. And if you have these things in writing, that gives them an opportunity to take a look at them on their own time, and maybe even keep them on hand to look at before class if they're concerned about that. Now, some unsafe activities in class. So in your fitness theory course, you learned that the Valsalva maneuver is caused, or the Valsalva effect rather, is caused by holding your breath and exerting effort. The pressure restricts flow of blood to the brain and heart and may cause dizziness, fainting, and in severe cases, coronary problems. This is kind of a gym meme that we're seeing a lot now on social media and things like that, where someone will lift a really heavy weight and then they'll faint. This is not funny. This is very dangerous, not just because you're holding a heavy weight, but look at what you're doing to your brain. And I still encounter a lot of trainers and instructors who feel like the Valsalva maneuver is a positive thing to be doing, and it is absolutely not. So we advise people against that. It causes your heart to work harder than normal and increases pressure in your arteries. It can also cause things like hernias, hemorrhoids, broken blood vessels in the face, eyes, and uncontrolled bowel movements or gas. If you tell people that, like you might pass out and also have a bowel movement, then they're probably going to be even more likely to not do that again. Many exercise injuries are due to overuse, doing the same exercise too hard or too many times. A repetitive exercise stresses the same part of the body over and over. And that comes into play when we see things like running and only running and things like that. When someone is only doing one type of exercise, they can certainly end up with things like shin fractures from overuse. Continuing to work muscles after their fatigue affects the quality of the exercise as well, and can also cause injury. And that's where we're looking for the failure aspect. So not in that they failed in doing the exercise, but that muscles are starting to fail. So that's when we talk about training to failure. That's until they can no longer maintain proper form. And as soon as they can no longer maintain proper form, they have to stop the exercise. Now, yes, too much, too heavy, too soon. Consider that cross training reduces the risk of injury from overuse. If your exercise regime has variety and you listen to your body, you're going to greatly reduce the risk of injury. Now, the body adapts to overload, progressive overload, by getting stronger and fitter if you increase the exercise load carefully, and that does need to be specific. But if you stress part of your body before it's ready, even a simple exercise is potentially going to cause an injury, or you might be training yourself into injury by using improper form, and it might not happen for like 6 months or a year down the road, but it will happen eventually. A lot of beginners hurt themselves because they try to do advanced exercises before their bodies are ready. Experienced exercises can also suffer an injury if they attempt to perform an exercise beyond their fitness level, or simply do the same exercise over and over again. So look at those modifications for intense exercises. If people want to do box jumps, get them to perfect the low box jumps before they try the high box jumps. Get them to perfect jumping on the hard surface before they try and jump on the soft surface, and things like that. Now, slow incremental increases in weight. Weight training exercise becomes unsafe when you try to lift too much. That's not just because you might drop the weights or drop them on yourself or another person, but also because your muscles are going to be overtaxed, and that's where we can lead to excessive tearing and strain. Many people hoist weights using momentum, which I'm sure you've all seen, where the whole body is moving in order to do a bicep curl or something like that. Exactly. Yes. Not okay. And if you've been in a gym, you've seen people swinging to make it through the reps because they're simply lifting too much weight. And that, again, maybe they want a certain number of reps. Maybe for the first 5 reps, it looked perfect, and then everything started to wobble around. So that's a great opportunity for you sometimes to maybe even approach a person in a facility where you work and say, I'm a personal trainer or I'm an instructor. Can I offer you some feedback to maybe help you do this exercise more safely? And that gives them the opportunity to say no, but I've never had anybody say no to that. Everybody I've spoken with has always said yes, please, because often they don't know what they're doing wrong. If you cannot lift a weight with control, so 2 or 3 seconds to lift and the same time to lower, and with good form throughout, then the weight is too heavy. That's something else you're going to see people doing, is when the weight starts to feel too heavy, they lift faster because there's less time under tension. And that also is not what we want to be doing. We want to be maintaining that good pace. Yeah, exactly. It's also important to know that the muscles will slowly adapt as you slowly increase the weight and resistance to the muscles. This is especially true for seniors. So, piling on the weights will not make the muscles respond any faster and can certainly injure connective tissue, which is going to put you out of commission for its extended periods. Those sorts of things can lead to an itis. So, an inflammation in our joints, for example, is one thing that can come. Even though maybe the muscles are okay with it, we also want to allow the joints time to heal. Um, this is the safest way for seniors to gain strength and people in general. So slowly adjusting and increasing. Just remember that there's different ways to change intensity. You can increase weights, you can increase or decrease reps, you can decrease rest time, and also tempo. So rather than increase weight every time, you can instead increase the number of reps or shorten rest time and even change the tempo of the exercise. When you do make a change, only change one element at a time. I love increasing the number of repetitions because it really hits home for people that a 5 pound weight gets a lot heavier after you've lifted it 30 times, right? And then we have progression. So for progressing fitness levels, a safe percentage is 5 to 10% weekly, and that is not infinite. Progression will slow as they meet their genetic limit. So as an example, if they're doing a 10-minute walking program 3 days a week, and the following week adding 5% to 10% would be another 30 seconds to a minute more of walking. And when you explain it to people in those terms, it seems a lot more achievable to them a lot of the time as well. So now some unsafe activities in class. These are contraindicated joint movements. Full neck circles, specifically rolling across the back of the neck. It's okay to roll across the front, okay? So chin to chest, and then we very gently, in a limited range of motion, go side to side, but we never roll across the back because then we're compressing nerves and that can cause some issues. Shoulder movements behind the neck presses. So like upright rows, this can stress the shoulder joints and also lead to injuries. A safer alternative is to do a shoulder presses in front of the body. So keep that in mind. Mhm. And then, yes, behind the net. And so lat pull downs are another thing that really nobody should be doing behind the neck. And again, you see some people who are training kind of in an old school way where we didn't even have a name for anterior head carriage 20 years ago, right? So these people are pulling it down behind the neck because it will make your traps bigger. One of the reasons it makes your traps bigger is because it causes those muscles to bunch, and they don't get a lot of stretching. So a lot of those people will have tension in their upper body and their head will be carrying forward. So when we do a lat pull down, it should be coming down to the chest and not the back of the head. With our upright rows, these can cause shoulder impingement. Another better option for that is lateral raises with light weights. Bethany, you've got a hand raised? Mhm. Take your time.
My computer keeps twitching.
Me too.
Sorry.
I get it.
Yesterday I was at physio and they have this gym and I saw the lat pull down and I said, okay, what if somebody couldn't do that machine?
Hmm.
And then I got thinking, okay, what if they can't raise to pull
Hmm.
down? What
Yep.
else can they do? So I took a weighted ribbon, very lightweight, and
Mhm.
I tied it, and then I just brought the lats back like down, like back
Yeah.
like this.
Hmm.
Would that be a modification right there?
Absolutely. Yeah,
Okay.
absolutely it would. I would say for sure. Another option that you might use is certainly with very lightweight, you can maneuver the weight for your participant. So you would have everything set up at the bar and then you grab it on top and pull it down to their chest height. And then you can also guide it so that if you think they're going to let go really quickly, just have your hand around
Mm.
the cable. And again, this is like less than 15 pounds that we're using, probably more like 5 to 10. So at the lowest setting. But yes, absolutely, that's an excellent idea. And you don't even have to secure that to a surface. You could be sitting down and do rows with the band looped around the arch of your foot and pulling back like that for certain. Yeah, for sure.
Oh, yeah,
Yeah,
true. Yeah, for
yeah,
secret. Yeah, that's
yeah,
good. Because I
yeah,
was also thinking about, what if they're in like a scooter or something, and I was
yeah.
trying to think of like how they were going to do that, but that's a good idea.
Yeah, loop it around the foot, and you don't even really need a surface. Like you could do that as pullbacks, like just holding the band with no
Because
tension
it's
really,
still,
and just
yeah.
widening the hands as you pull back, and that will get the lats as well. Yeah, yeah. I love that you came up with that solution. I think that's a really great alternative to the lat pull down for sure. Now we have deep back bends. So these can compress the spine and cause back pain. Partial back extensions or baby cobra poses are safer. We'll look at this in our in-person day as well. So when you're on the floor and coming into a cobra pose, which is where you're laying face down and then you have your hands under your shoulders and you arch the back and lift the chest. That is more safe for people if you're guiding them into not using their arms at all. So we're using the back muscles to essentially do a back extension to lift up like that. If you want to bring them into an upward dog, which is a deeper stretch than that, where maybe the hips are off the floor, start in plank pose. Never ask people to push up from the floor because there's a much higher potential for hurting the lower back. If you start in plank pose, the abs are already contracted and they can move slowly to guide their back into that. We also don't want to be doing any unsupported flexion with weights, such as a good morning. Okay. You might do good mornings with hands on a chair or a wall, and only with body weight is a great way to start the good morning. And that's basically just we're taking a bow from standing and bringing the body down to maybe level with the floor, maybe slightly higher. And sit-ups. We've said a few times how these are really an unnecessary exercise. Nobody has to be doing a sit-up or a crunch. It can put a lot of strain on the lower back and also the neck. Dead bugs are a gentler alternative and are going to engage all of those same core muscles. And then deep squats. We do not lower the thighs below parallel to the floor. That is pretty standard unless you are training for specific purposes or you're very familiar with a person's body. Very deep squats can be excellent for the body. So getting down into that, even the resting squat position, heels are on the floor, hips as low as they're going to go, and you can basically relax there and just balance on your hips and heels. Great for people. Most people aren't going to be able to get there right away. And so that we avoid hyperextending the knees, we're not going to bring our thighs lower than parallel with the floor. And then leg presses. So these can cause lower back issues if they're not set up properly for the individual. Body weight squats or using resistance bands tend to be better choices. But again, you might train people whose only option really is using machines because they have a lot of instability. They're very new to exercise. So you might want to put them on the machines, in which case leg presses can be great. But again, we're always starting with the absolute lightest possible weight, which might only be the weight of the machine itself, no added weight. And then they're getting the movement, the foot placement, the alignment before you're moving on to adding anything. So a few general tips of things to avoid. We are avoiding rapid, repeated, or ballistic movements. Ballistic movements are not well controlled. They're fast and explosive. We never, ever coach ballistic movements, okay? And the rapid and repeated movements can be good for a short period of time, but we're not doing those for an extended period of time, and we're making sure that they're always controlled, even if they are fast and repeated. All of these things can decrease our joint load tolerance and increase the risk of injury. So often people will have a weak point in their joints. So if you go from standing to the deepest squat you can manage, there's going to be a point in there for most people where all of a sudden they're pretty weak and they might just even like fall over. It's usually where the hips lower below the knees. Just for a second, all of a sudden you're super weak. And if you do that really fast, again, there's a much higher potential for injury, for falling or losing your form, or even just collapsing entirely in that pose. And then maintaining proper form. So we're always ensuring alignment and control to prevent unnecessary strain on the joints. A few more unsafe activities. So, muscle imbalance comes from exercising the muscle on one side of the joint more than on the other side, the opposing muscle. That's when we are creating a muscle imbalance. The stronger muscles can pull the joint out of alignment. When planning the weight training portion of the class, ensure working both sides of the joint equally to prevent muscle imbalance. Now, if you're working with a personal training client, that might be throughout the week. They might have a chest day and then a back day and then a lower body day and a core day, etc. If you have just that 1 hour and you're not sure who's going to show up next time, try to get all of the agonist antagonist muscles. So get that balance in there in that 1 hour, and that's going to help them to prevent the imbalance later on. Bad technique. So certainly avoid uncontrolled movement of the limbs. It can cause hyperextension and put additional stress on the joints. The incorrect position of a joint or supporting limb can make a good exercise risk injury. So as an example, swinging a leg back and forth in flexion and extension or swinging it side to side can risk injury to the hip joint or strain a muscle or tendon or ligament. Lifting the leg in abduction and lowering in adduction in a controlled way can strengthen the hip abductors and adductors, which is supportive of the hip joint. You'll see a lot of fitness professionals have people doing leg swings. That back and forth one is one I see a lot, and it really looks like kind of an uncontrolled movement because they're swinging it to its full range of motion. Sometimes the body's getting involved too, and it's just really not safe for most people, especially for that supporting knee. Exactly, yeah, because we're working to that full range of motion, and things aren't usually warmed up yet. So just consider that. If you make it slower or maybe do slow circles instead of swings, then that can add a little aspect of focus and control to that. Now, poor instruction and cueing. So this is one that's under our control, which is positive. Poor cueing can cause participants to bump into each other during cardio. If resistance training cues aren't correct or easy to understand, participants may use improper form, and of course, injury can result from that. Make sure that you're not demonstrating exercises that you can't do yourself. And those are the general guidelines. So beyond that, of course, we're going to branch out into breathing cues and postural cues, letting people know where they should be feeling the exercise when we're doing strength training. And just on that note too, strength training is different from flexibility training. So with strength training, we always should feel the exertion in the target area. With flexibility training, you're going to feel the stretch in any of those muscles along the chain that you're stretching, right? So it might be a different spot from morning to night, and that's perfectly fine. So consider like a list of things that you can let people. Where we don't want to feel things in a stretch is in the antagonist muscle. So if I'm doing this and trying to stretch my tricep, this is the agonist muscle. This is the one that I'm trying to stretch. If I feel this in my bicep instead, it's more than likely a cramp. Okay, it's probably not anything to do with a stretch and might indicate potential injury. So just that awareness piece. Now, levels of functions, needs, and simple activities. In these next 5 slides, we're going to be looking again at the 5 levels of functional ability. Again, very important to know for your exam and when you're working with your clients. But we're also going to zone in on what their needs and appropriate activities are based on their functional level or designation. We're going to start with the physically frail. Most likely, these participants are going to be living in an assisted or community living, as they are unable to do many of the basic activities of daily living that would allow them to live independently. And this might be a situation where you are going into the facility because these people maybe don't have the mobility to be able to leave their homes a lot of the time, especially in the colder months. Things that they would need to work on would be light strength, range of motion, balance, and the coordination necessary for them to perform basic self-care activities of daily living, like self-feeding, bathing, dressing, toileting, transferring, and walking. Activities that include range of motion and strength at the hips, the knees, the legs, the ankles, shoulders, arms, and wrists and hands are also important. Go ahead, Bethany.
Sorry to interrupt. This
Oh,
kind of
you're
it reminded me of what something that happened earlier. This one of my senior ladies, she's a retired nurse,
fine.
and she's doing pelvic floor exercises to help with her bladder.
Right.
And I know that we want to avoid doing anything that could cause problems in that
Mhm.
area.
Yeah.
Is that something that you would potentially help them with, or would you want them to go strictly to like somebody who is
Mm.
specialized in that?
That's a great question. You are absolutely qualified as a fitness professional as long as you can cue it properly and work closely with your participant to make sure they're feeling these things in the target area. You certainly can assist them with pelvic floor exercises. The way that I explain it to people most easily is that you're essentially holding your pee is what you're doing, and that should be the feeling that they get. Sometimes, I mean, I have a lot of my older participants will laugh when I say that, and then I'm like, no, it's funny, but I am serious. is. Like, that's the best way to know that you're doing it. Another really great exercise for pelvic floor is coming down onto your hands and knees, putting a stability ball behind your bum with your knees lined up with the stability ball and pushing back into it. And that will give people the proprioceptive feedback to really understand where these pelvic floor muscles are. And I advise that in all of my yoga classes. I'll tell people engage, let's say, the lower abdomen, suck the belly button toward the spine, lift the pelvic floor, and pull the hip bones together in front. And then they're going to get that sphere of muscle. Do keep in mind that those are muscles that you can overtrain. So if someone's already doing pelvic health and pelvic floor exercises, you might want to have them, just advise them to, you don't have to do it every single day, should certainly not be for hours a day, should not be using devices to help with pelvic floor exercise because that can exacerbate things as well. But yeah, no, absolutely. If you're comfortable cueing it, definitely bring it into your classes. Yeah.
I'm actually hoping to bring in a pelvic floor expert
Yes.
to one of my programs.
Amazing.
I'm
Yeah.
excited. Oh, cool. That's
Yeah.
cool. Cool.
Yeah, I think that's so fabulous. And then you'll be able to learn from them and also use those tools for your classes as well, because not everybody's always going to have access to that individual. Yeah.
I'm quite thankful. I have a lot of seniors have various backgrounds, and she just happened to be a nurse, and we got talking about pelvic floor and exercises and rate of perceived exertion and all of this for like
Yeah.
a good 30 minutes. So it was great.
That's so great. That's awesome. Good for you. Yeah, I noticed that once you get into this industry, the number of people that will just kind of gravitate towards you because they love to talk fitness and wellness is what they like to discuss. So yeah, sharing information is so important for sure. That's
I'll let
great.
you know how it goes.
Yeah, please do. I want to hear what you learned from it and yeah, how your participants like it. That sounds amazing. That's great. With our physically frail, we also want to be working on ankle flexion, foot mobility, and hand and finger mobility. Those are all important. Many of my seniors yoga classes all finish with a hand massage and stretching because not only is it calming for the brain, it's also very important for that area of the body. Also, the speed of movement for gait and power to get up from a chair, a toilet, etc. So we talked about one of the highest risks of falling is when people are getting up to answer the phone. So we would like to help them to train in that explosive movement and that speed when they start to become safe doing so. And that might mean setting up a row of chairs facing a wall so that people can stand up as fast as they can and they've got the wall there for balance if they're not able to maintain their balance, things like that. So a few recommended activities for the physically frail group would be chair and chair assisted exercises addressing the basic activities of daily living, one-on-one water-based exercise or class water-based exercise, excellent for most people, but again, consider the resistance of the water. So lateral motion in the lower body is going to encounter resistance in the water, might not be okay for everyone's knees, just as an example. But for most people, that water-based exercise is going to be great. One-on-one strength and power training. We want function-based exercise for upper and lower body. So think about what are they going to be doing? Reaching for things on a high shelf or carrying groceries in from the car. Things like that are very important. Um, Seated coordination exercises. So yeah, work on that coordination and balance while they're in a chair to start with. Seated speed of movement activities with special focus on ankle, hand, and finger strength and mobility. One-on-one balance training, physical and occupational therapy, seated recreational activities. So many fun games that you can play with people to work on their reflexes and their strength and things like that. Just have them having fun. And also breathing and relaxation. So a few of the games might be something like a seated ball toss or a bug stomp, things like that. So there's lots of fun things you can come up with. And then we have our physically dependent. These folks might be living on their own, but have some challenges with some of their activities of daily living. They might be living with a debilitating disease or condition that challenges them physically. And that's actually the majority of humans nowadays in the modern world are living with some kind of disability, chronic conditions, and things like that. So be compassionate to that for everybody who comes to your class. We also want to be training muscular strength, endurance, and power. We're doing some low-level cardiovascular endurance, range of motion activities, balance, and coordination, all of those things that are necessary to perform the activities of daily living. And so note that this group can do everything the physically frail can do, and also include additional activities that challenge balance and address postural and gait abnormalities. So you want to just add on to that. As well, they can do group-based water activities, so they don't require the one-on-one support like the physically frail might. And they can do modified Tai Chi and yoga. They can participate in group supervised strength and power training, play modified recreational games, do seated dance activities, maybe chair exercises with 5-minute aerobic endurance segments, and also walking is definitely encouraged as well. And if you have people with lower body mobility challenges, see if you can get them on a recumbent bike, or an arm ergometer is a really great option too. I know the Zatzman Sportsplex has one, and that's basically a bicycle for your upper body. Yeah, that can be adjusted. And also the new step, which is basically a recumbent elliptical machine where people are sitting down, but they have their feet on pads and their hands on handles. And when you move the arm segments, the feet move as well, whether or not you're using your lower body. So really great for people recovering from stroke issues and people who have limited mobility in the lower body. So lots of options out there. Now, are physically independent. They are usually living without major chronic disease or debilitating symptoms, but they might have low reserves of health and fitness and could be functioning close to max capacity just to live independently. So that's what we want to help them with. Once they've done their activities of daily living, we want them to have some energy and some strength left to do the things that they enjoy, not only have to take care of themselves. These people might be one fall or a bad flu away from becoming physically dependent or even physically frail. For their programs, they need to train muscular strength, power and endurance, joint range of motion, balance, coordination, and cardiovascular conditioning to remain physically independent and prevent illness, disability, and injury. So that might be a conversation you want to have with these folks, is that it's important so that we can maintain what we have, we keep what we have, and hopefully also make that better, but also so that they can recover more quickly. I know it is flu season now. Oh my goodness, so many people are sick. So remind your participants of that as well, that this is going to help us to avoid getting sick and also recover faster when that does happen. It is great to include education during your sessions on the importance of preventing functional loss and to encourage people to develop an increase in their health and fitness reserves. Even those classified as physically independent can have a range of functional abilities. So you want to provide modifications in class. These people can do any of the activities from the physically frail and dependent level of function, as well as chair aerobics, low impact aerobics, line and folk social dancing, water aerobics, lap swimming, walking, Tai Chi, yoga, circuit training, strength and power training, and recreational and sports activities. So a fairly wider range with these folks. And then our physically fit older adults are those who exercise at least twice a week for health and enjoyment, are generally physically active, and have high health and fitness reserves. Their training should include muscular strength, power and endurance, joint range of motion, balance, coordination, agility, and cardiovascular endurance. So a couple of extra things in there, particularly the balance, coordination, and agility, as well as cardiovascular endurance. So we're not just going for cardiovascular activity there. We're looking to build on that. We want to be educating these folks on appropriate exercise intensity and injury prevention, and teach them the rate of perceived exertion, the talk test, and max HR intensity, and how to best monitor their intensity. So, for example, if they're on beta blockers, which option is going to be best for them to monitor their intensity? We would use the rate of perceived exertion. They're able to do most activities if modified as required, and you might not need to modify them at all for this group. For example, these folks might play hockey in the Gentlemen's League, where it's slightly less intense and nobody checks on purpose. So I did have a friend recently who's almost 70 and broke his collarbone and shoulder because he ended up slamming into the board. So nobody checked him. And he's been playing hockey for years. He's very physically fit. So this can happen really at any time. And if you know folks who are playing hockey, make sure they are cross training. One of the highest possibilities of heart attack is on the ice. Okay, and rec facilities are very much aware of this as well. That's our highest instance of heart attack, is when people are playing hockey because they do not cross train, they do not warm up. So make your participants aware of that. If they play hockey, what are they doing to warm up before they play, and what are they doing in the days in between, so that they can keep their body nice and safe and healthy. Now on to our physically elite. These are older adults. They train almost daily. They might compete in sports, work in a physically demanding job, or participate in strenuous recreational activities. Um, oh, no problem at all, Bethany. Yes, we're just saying that the computer's spazzing out a little bit. That's completely fine. I understand. The recording will be available later if you happen to miss anything. So no problem there. Absolutely. So these folks might also compete in sports, work in a physically demanding job, or participate in strenuous recreational activities. They're usually very motivated to stay active and enjoy higher health and fitness reserves. And they also really recognize and appreciate the benefits of a physically active lifestyle. For these folks, we should include exercises for muscular strength, power, endurance, flexibility, and agility, and high levels of cardiovascular endurance. Injury prevention and recovery is really important. So you might want to have conversations with them about what recovery looks like, because these people also might be at risk of overtraining, especially as folks get older, our appetite decreases and our body has less ability to absorb nutrients from our food. So you might want to talk to them about their protein intake, not as a dietitian or nutritionist, just as a curiosity. If they're sore all the time, their muscles aren't getting bigger, maybe they should speak with a dietitian or nutritionist. They might also want to include activity specific training to improve performance in a desired area. So this would be the SAID principles, specific adaptations to impose demands. The primary role of the instructor for these athletes is as a facilitator to help these participants maintain their levels of fitness and improve their performance. They can do pretty much any activity for the most part. So do feel free to challenge these individuals, and you might end up with one or two physically elite participants in a class of 30. So if possible, try and include modifications that will help them to feel like they're getting a lot out of the class, just like everybody else. Now on to lesson planning. So we just reviewed the 5 levels of functional ability as it relates to what types of activities and exercises folks can and should do. With that in mind, be aware of different fitness and performance levels in the class. We're always watching for that, and also have modifications ready for all of your planned exercises. So I always go by the guideline, at least 2 modifications for every single exercise you teach. So there's 3 variations total, and you would usually always want to start with the least intense variation and then give 2 more intense variations from there. You will probably have physically independent individuals in the same class as your physically elite participants, likely not physically frail along with physically elite, because those might be specialized classes. But you might have someone who's physically dependent and physically independent and even physically fit in the same class. So choose activities suited to the participant's physical state and emotional state. Make sure you're including primary and secondary movement patterns, both traveling and stationary, and of course, alternative exercises. If some participants have problems keeping up with the intensity, encourage them to go at their own pace and show them some easier moves without calling them out, of course. Provide them to the whole class and remind people again, this is your class and you are working at this level of intensity, never too hard. Provide good instruction before, during, and after, all the time, every time. Give proper cueing, correction, and feedback to participants. That's really crucial for a safe and effective class. Make sure to advise participants of potential risks. And that can be something like letting them know why we are not locking out the joints, right? And we're not locking the knees because that can put unnecessary pressure on the knees and lead to injury. So we're going to keep them nice and soft as we move. Make sure you're giving clear and concise instructions. Keep an acceptable student to teacher ratio for seniors fitness classes and any fitness classes. Maintaining an appropriate instructor to participant ratio is really crucial for ensuring safety, providing personalized attention, and effectively managing the class. Now, your client to instructor ratio is kind of going to be up to you. Make sure you check with the facility you're teaching and what their maximum capacity for a class is, because maximum capacity for fire safety is going to be much higher than maximum capacity for a class, right? So find out what that is. Some facilities might not know. So maybe take some time to go in ahead of time and set up all of the stations spaced out properly, and then you can decide how many people should be safely able to work in that space, and get used to potentially turning people away. So if people are showing up and your max capacity is 20 and you've got 21 and you let that extra person in, but people keep coming, you need to be able to say to them, I'm sorry, we're at max capacity. It's just not safe to let you in, as much as I would love to have you join us. So please do come along next time or try this other class or something along those lines. If you end up with that issue regularly, having a sign up sheet is a really good idea, or an ability to register online, because then people have their spot reserved and they're not going to argue about who got there first and things like that. So generally for an older adult class, an acceptable ratio is one instructor for every 5 to 10 participants. You will end up with classes that have more participants than that. Just make sure that your participants are all fairly independent, because if you have to pay special attention to 4 to 7 people, it's going to really detract from your ability to instruct the class. So just be aware of that. That 5 to 10 participants for every one instructor allows you as an instructor to monitor each participant closely, offer modifications as needed, and also ensure that everyone's performing the exercise correctly. The correct ratio matters for a few reasons. The first is safety. So seniors might have varying levels of fitness and health conditions that do require close supervision. Also, personalized attention. So smaller class sizes enable instructors to provide individualized feedback and modifications. And then lastly, effective management. That helps in maintaining order and ensuring that the class runs smoothly. It's always a good idea to adjust the ratio based on the specific needs and abilities for the participant. So for example, classes with participants who have more significant health issues or mobility limitations might benefit from a lower ratio. We want to make sure we're keeping the volume of the music at a level where your instructions can be heard by the entire class. So can anyone remember the maximum level of decibels your music should be on for a class? You say 85? Yes, 85. Fantastic. Thank you. And your voice needs to be 10 decibels higher than that in order to be heard. So we should have the music at lower than 85 decibels so that your music, your voice can be heard over the music. And again, remember to ask your participants, because regardless of the decibel level, we might also have weird acoustics in the room. Go ahead, Ocean.
Is this an exam question?
The highest level of decibels is an exam question.
Because
So
there,
that might
this
be an
is,
exam question. You don't have to calculate the level of your voice based on the music level. What you do need to
so
know
the
is,
answer would be 85, not 70 or 75.
yes, exactly. And
Okay,
also make sure you know that your voice has to be 10 decibels higher than the music. Yeah.
right. But so like, I feel like that's kind of a silly exam question because I know like we say 85 for the music, but that's not really true because it's really 75 if we want to speak.
That is very true. What we're asking there would be, if it is an exam question, it would be more like, what is the maximum number of decibels before you're actually hurting your hearing? So that would be what we're looking at, is the maximum volume, not necessarily max volume in relation to your voice. It's max volume of everything. So
Okay, I see.
yeah, so you won't have to do any calculations. Just know the 85 and the 10. Mhm.
Okay, thank you.
Sure. Also, make sure you're teaching your participants how to use equipment properly. This includes how to pick up weights safely. That's a big one, especially if people fatigue. I've heard a great saying that goes that any exercise is a lower back exercise if it's done wrongly enough, right? So if you're picking up your weights and you're bending from the hip and reaching for the floor, that's all of a sudden a lower back exercise. But if you're bending your knees and dropping your hips down, that is a good thing to guide your participants up. Anytime you're picking anything up off the floor, bend with your knees. So we lift with our hips and not with our lower back. Make sure you safely terminate the instruction of an exercise session when a participant exhibits signs of physical distress. And that doesn't have to mean stopping immediately and going to that person and saying, oh my God, are you okay? If they look like they're in mild distress and you don't want to call them out right away, slow things down to a march, or tell people, okay, we're going to take a water break, just don't stop moving. And then that'll give you an opportunity to check in with that person without calling them out. And obviously, if it's very evident that someone's having having physical distress or mental distress, then we do want to stop the class and address that directly. And we never leave an injured person unattended. That also stands true when the injured person decides they want to run away to the bathroom. We or someone in the class is going to follow them and make sure that they're okay. This happens quite commonly when someone is choking or potentially having a heart issue because they don't want to be embarrassed. They don't want to disrupt the class. So they'll run away and get in a bathroom stall. And then things can get a lot worse really quickly because they have a medical emergency. So just make sure of that. And a good guideline too is tell your participants if they need to leave the class in the middle of class, give you a thumbs up on the way out so that you know that they're okay. Okay.
That choking thing can actually happen. It happened to me. I was thankful I just got recertified in CPR and first
Hey,
aid,
yeah.
but
Wow.
it happened. If you had said that before that happened, before I witnessed this, I wouldn't have
Mhm.
believed you because it didn't seem,
Right. Pardon
you
me.
know, like, I'm sorry. Are you okay?
Oh yeah, I'm fine. I'm just choking on my tea. Speaking of choking, go ahead.
Let's not choke. I choked on air earlier, so I understand. Yeah, no, he ran to the bathroom and everybody else was just kind of looking. And I said, okay, I don't like this. So I went and he was gagging and gagging and gagging. And he actually started throwing up and it was like a whole
Wow.
situation.
Mhm.
And he just took a bite of his burger.
Okay.
And
That's
it,
crazy.
yeah,
Mhm.
but the thing is he was on what we've been calling like the younger
Mhm.
elderly,
Yeah.
and so and he no cane, no problem,
Mhm.
nothing,
Yeah.
and it just happened so fast. But
Right.
instead of asking for help, he was embarrassed. He ran away.
Exactly. Yeah.
It was so fast, so quick. It really
Yeah.
does happen.
Mhm.
Yeah, that was an interesting experience.
Yeah, well, good for you being able to handle that. Because often too, when people are younger, they have more stamina to make it to the bathroom while they're choking, which and it can look like nothing. But yeah, no, good on you because it certainly does happen, and it can happen at any age for sure.
Yeah, crazy.
Yeah, it
Very.
can be a very tricky thing. All right. Now, developing your own adaptive exercise program. So, before you decide what you want to teach, where you want to teach, and to whom you would like to be teaching, there's a few things you would want to be researching. So, determine what the needs are in your community. Read the leisure guide from your local recreation center, talk to seniors in your community, maybe also touch base with seniors' facilities and ask them what they might be looking for. Um, you can also contact seniors' homes and care centers to determine what's being offered at those facilities and what they might be lacking. Shanix is a great resource. They have so many wonderful spaces that are underused in those buildings. They do have concerns sometimes about conflict of interest. So you couldn't go in there as a personal trainer, but if you wanted to volunteer to offer a class to their participants, they're often very open to that. Know whether or not there are any groups being left out or ignored, such as places like Osteoporosis Canada, the local chapters of Parkinson's disease, the Arthritis Society. I know that brain injury and stroke groups are often very much left behind, and they don't have a lot of recovery options after they're out of hospital and finished with their physio and things like that. So offering things like that, especially in rural areas, can be really beneficial. um, Mentor with other instructors and learn what they're doing and what works for them, and also going to the city planning department to look at the demographics of the community. Know how many seniors are living in your community and where they're living. Often, as we saw, higher ratio of seniors in rural areas, but there are still quite a few in metropolitan areas as well. Very high population, and in Nova Scotia we have the highest population in Canada of seniors. Many older adults also consider that they do not like to drive after dark. I'm not that old and I don't like to drive after dark. So just keep that into consideration, and how the timing is going to change throughout the year when the sun goes down earlier. Wherever possible, keep your classes to during the daylight hours. You will find a few seniors, retirees, I should say, senior or otherwise, who love to get up at 5 and 6 in the morning. That is not the majority. Most of them are going to be wanting to go to class between 10 a.m. and 2 p.m. Okay. Usually not at lunchtime, because often they have a very specific schedule where when they like to eat. You could offer to give talks or mini workshops to seniors groups. You could volunteer to sit on committees. Make yourself, your classes, and your business known to other fitness and health professionals. That's what's going to get you more attendees and potentially more places to instruct. People like therapists, public nurses, public health nurses, chiropractors, and others who work with seniors, they'll have an insight into the needs and interests of their clients. So Bethany says, Queen's University, whose logo is on one of the handouts, is the funder for your classes. Are they? Is that what I saw there?
The outreach program that I do for the senior,
Oh,
they,
that's fantastic.
yeah, when I was reading the handout stuff, I was like, of course, they have one of the best gerontology programs ever. I was there
Yeah.
last year for well, I basically went there and begged for money and they gave it to me.
Okay, good for you.
But
Yeah.
yeah,
And that's a
yeah,
testament to how that kind of thing absolutely works. Also, when you go, you express that there's a need, ask for help, and often it works out that way. So
yeah,
that's
yeah. That's
amazing.
small world, eh?
Right? Yes. Ocean's giving a thumbs up to that. That's
I saw
amazing.
the floaty thing.
Yes, that's so great. Right on. All right, so that is the end of those chapters. Now we're going to get into the exam review. So, can anyone tell me the 5 levels of functional ability from the most functional and able? What's the top?
Elite?
The physically elite. Absolutely, yes. And what comes after that?
Independent.
Very close. We have before the independent, we have physically
Oh,
fit.
physically fit.
Yeah, physically fit, but you're absolutely right about that next one. Then we have physically independent. And then after that,
Physically
Dependent.
dependent.
dependent. You're both right. Fantastic. And what about after that?
Frail.
Frail.
The frail. Yes, absolutely.
That's how I feel right now.
I know, you know
Oh,
what? Sometimes I'm there too, and that's a great thing to acknowledge as well, because sometimes also understanding, like, if you have a day where you physically feel really rough, consider how it feels for someone who has chronic pain. If you have a day where
Yeah.
you feel super weak, maybe you're just getting over the flu, then that might be how somebody feels all the time. So yeah, absolutely. It's good to kind of reflect on that. Yeah, and help them out of it, like we can help ourselves out of it as well. Now, the benefits of cardiovascular activity for older adults. Can we just shout some out here? A couple of benefits of cardiovascular activity.
Heart strength.
yeah.
Heart strength. Yep, absolutely. And there's a couple of, go ahead, sorry. No? Okay. So a couple of things that involves. So we do increase our respiratory function. So in increasing our heart strength, we maintain or increase our stroke volume. We reduce resting heart rate and blood pressure, and we help reduce the level of blood lipids, which helps with insulin sensitivity. So consider that too. Help with insulin sensitivity is a pretty big one as well. Increased insulin sensitivity helps reduce the risk for type 2 diabetes and arterial sclerosis. And in strengthening the heart, we also decrease the relative risk for fatal coronary artery disease compared to sedentary lifestyle. This does need to be maintained because effects don't last. So keep that in mind as well. And now, for which of these conditions is an isometric contraction not recommended?
Diabetes.
Hmm?
Oh, hypertension.
No. Hypertension. Yes, got
Oh,
it. Exactly. Yeah, that high blood pressure for sure.
oh
Because
yes.
don't want to exacerbate that. You got it. And other things too, like glaucoma is one for sure. Concussion is one as well. We don't want to increase that intracranial pressure. And I will say, isometric contractions can be done like weight training. They can be done safely that way, where we contract as we exhale and release as we inhale. So when we talk about isometric contractions here, we're talking about contracting the muscle and holding. holding for several breaths. And that is not what we want to be doing with our participants, okay? Now, Sally was disruptive in class, constantly speaking with the people around her. What is the best approach to deal with this? Would you call her out during class and remind her that she's there to exercise? Would you ask her to leave? Would you speak to her after class about how to balance her desire for social interaction and for exercise? Does any of those sound good to you
Yeah.
guys? Yeah, which one?
Let's ask her to leave. No.
I was gonna say, get out, Sally. Right?
No. Speak to her after class.
Yeah, exactly. Yeah. So give her that one-on-one talk. And also like be encouraging about it. Like, Sally, I love that you're so social. You're so welcoming to everybody in the group. But I just want to remind you that we do have to start and finish the class on time, and that talking to people during class can be distracting or something like that. And even let her know, like if someone's distracted during class, they might end up sustaining an injury, which nobody wants. So if she can wait till after class or before class to speak to them, then that's the best. What is atrophy? Is this digestive issues, muscle wasting, muscle building, or sedentary behavior?
Muscle wasting.
Muscle wasting, absolutely correct. Yes, fantastic. If a participant complains of lower back pain, which of the following would you recommend? Would we say, it's okay, they just need to work through the pain? Suggest that they just do what they can? Tell them to do the stretching portion only, because that might help? Or do they seek advice from a healthcare professional? So we're talking someone shows up, they have a new pain in their back. This is not something they've been living with for years and years. It's brand new.
Oh, they should go see their doctor.
Yes,
Health
absolutely.
professional.
Yes, refer. And especially when in doubt, always refer. Yeah, great. And again, if this is a diagnosed condition, if their doctor says that exercise will help or that they need to strengthen their lower back, we could suggest that they just do what they can.
They
okay?
can.
Yeah. Absolutely. Now, yes, would they require clearance before resuming class? Again, this is a brand new pain. They just showed up today.
Yes.
This morning they had it. Yes, absolutely. They would require clearance. Yes. Great. Oh, the stages of the trans theoretical model. So this is where people are getting into the process of making change in their lives, right? So what's the first one where we're not even thinking about doing anything to change?
Sorry, I had a fly on my.
That was great.
I forgot that.
Pre-contemplation.
No
Is that
worries.
pre-contemplation?
Pre-contemplation, you are absolutely correct. Yes. And what comes after pre-contemplation?
Contemplation.
Contemplation, exactly. Yes. And then what's after contemplation? We've purchased the tickets to class. We're thinking about going.
Action. No.
What's that?
Action is
I
one of
think-
them, but
Yeah.
is it action next? No, there's something in
Which one?
between.
Sorry.
Action.
Oh, that's after the next one. You're very close.
Yeah.
I mean,
We're preparing to take steps toward change.
oh, planning.
Very close. Preparation.
Preparation.
Yeah, absolutely. And that's kind of very similar. So preparation is very similar to planning. They're telling people about their plans, they're buying gym gear, etc. And then after that, Ocean, you were absolutely right. That is action. That's where they're going to class. And then what comes after the action stage?
Maintenance.
Maintenance, fantastic. And is it possible for someone to go from maintenance, they've had 6 months, they're maintaining everything, and then all of a sudden they're back in pre-contemplation?
Yes.
Yes, absolutely. Yeah, and that might be because of illness or an injury or a loss or something like that. So for sure that can happen anytime. Now, Joe has been diagnosed with diabetes and was prescribed medication. He feels that his diabetes is well controlled with the medication and he doesn't need to exercise. What stage of the trans theoretical model is Joe in?
Oh, wait, Joe has been diagnosed.
No.
Yeah.
Joe is in the no stage. Yes. Which stage is that? Joe is an absolute, I'm not doing this. Pre-contemplation. You are absolutely right. Not going to change Joe's mind immediately. Maybe eventually, but not today. Now, our next one. What are some of the strategies you could use for participants who are visually impaired?
I think
Show them how to do it.
Show them how to do
Oh,
it.
yeah.
Absolutely. Yeah.
you could
Guide them.
say what, like, by steps, like what it is that you're doing, and be very descriptive.
Be very descriptive. Absolutely. And use those nonverbal cues for sure. Yeah, so show them what you want them to do, have them move through that movement. Absolutely. A couple of the other things mentioned here are keeping things in the room the same so they can easily maneuver around, using brightly colored items or even using brightly colored tape on the items can be helpful, and avoid machines that move, such as a treadmill. So again, recumbent bikes, pretty safe for just about everybody. And yeah, but yeah, we don't want to be putting people on treadmills and anything that could cause a balance issue if they're visually impaired.
Would the bike be okay though if say they have one of those canes and it's might get in the way and stuff? No, like was that still okay?
Like a cane for walking?
No, sometimes they'll
Oh,
have
oh,
like
for
the
visual assistance, for
yeah,
auditory assistance.
with the balls.
Absolutely. Yeah,
Okay.
for sure. And you can assist them. So maybe the first time, if they've never used one of these bikes before, you can assist them in getting into it. And then
Okay.
you can place their cane to one side and then give it back to them when they get back out.
True.
And then perhaps the next time they'll be able to kind of maneuver their way into it themselves. And that can give them an added level of independence. But yes, I would
Yeah,
definitely
true.
suggest that for sure. And some of them might be comfortable. They might come to you one day and say, I really want to try the treadmill. And just make sure you're using all the safety precautions. You're using the stop clip and everything, and making sure that their cane is not going to be in the way if the thing starts moving. Started out super slow, but absolutely encourage them to try more challenging things as well. Yeah. So, what are the Canadian physical activity guidelines? How many minutes of moderate to vigorous cardio activity should adults accumulate?
150.
Is that 80?
No,
You're so quiet. What's the answer?
I think it was like
sorry.
80 or 150. I can't
Very
remember.
close. Yes, it's 150. I would love
Okay.
it if it
Yeah,
was
I
180. I think
sorry.
that's
I
even
said
better.
one. I said
Oh, you're
150.
okay.
There's a bug and I'm trying to get him.
It's too funny.
I'm
I
so
hope you get
sorry.
it. No, that's okay. You're completely fine. And I'll say that usually you guys don't show up on the recording anyway, so you do your thing. Just no problem.
Oh, good.
That's good
Completely
because
fine.
I'm
Yeah.
blowing at the screen and everything.
That
Think
would
I
drive
can.
me nuts too. Absolutely.
He
Um,
wants to climb on my in your face. Like
oh,
I'm so trying to get
that's
him.
hilarious. Well, very good luck with your new friend there. That's too funny. So how many times per week should people be strength training?
2.
2 times per week. Yeah, and that's for maintenance and to prevent injury. If they want to increase their abilities, they should be training at least 3 times per week. And it's the 2 that we want to see as an answer if that happens to be on the exam. Okay. And then what do we want in addition to this? Cardio, strength,
Flexibility.
flexibility, and balance. Absolutely. Yes. Yeah. So make sure they're getting that as well. And that can be a daily thing. Some people are really comfortable doing short stints of things every single day. So give them a couple of 30 seconds to 1 minute balance activities they can do at home. What does FIT stand for?
Frequency,
Mhm.
intensity,
Yep.
time,
Yep.
and type.
And
Or
type.
type.
Fantastic. Exactly. Yeah, you got it. Great
Right.
job. Yeah. So that is our principle and how we design our classes. That's great. The PAR-Q Plus. Why do we use the PAR-Q Plus?
Because they answered yes to the part Q.
Oh, sorry. But PAR-Q Plus, I mean PAR-Q. Yeah,
Oh,
those are the same
why
thing.
do we
So
use it?
why
Oh,
do
so
we?
we can find out about their physical readiness.
Yeah, exactly. Yes, exactly. To determine whether or not they're ready to exercise. Awesome. Now, what do you do if they answer yes to any of the questions on page 1? So
Kick
for
them out.
page 1. What's that?
I said kick them out, but they got to go to their doctor.
They do, yeah. Well, first we would have them complete pages 2 and 3, and then sign and date page 4. So they can answer yes to some questions on page 1 and still pass the PAR-Q and not be referred to their doctor, as long as they answer correctly on pages 2 and 3, and then they sign and date page 4. If they answer no to the rest of the questions in the PAR-Q, so they've done page 1, they answered yes to, let's say, one question. They do pages 2, 3, and sign and date page 4, but they answer no to all of the rest of the questions on the following pages. Are they safe to exercise?
I think so, but
Yeah.
it depends on what they said no to or yes to.
Yeah, well, you're absolutely right. So yes, and that would be a great thing. Just take a look at that part Q so you can get a good idea of the questions, because they are essentially eliminatory questions on pages 2 and 3 that if they answered yes, might be one-offs, might be okay, like with the health conditions or the medications that they're on. Um, and pardon me. And then if they answer yes to any of the questions on the PAR-Q pages plus on page 2 and 3, what do you do then?
Doctor?
It's very
Absolutely, yes. Ask them to get medical clearance, and that is the eParamedX physician form that we would be using for that. Is there an age range for the PAR-Q?
No.
no.
No, you can use it for everybody. Absolutely, great. Now, what is the recommendation for someone having a breathing emergency?
Like they're not breathing?
Or they're hyperventilating or
Oh,
something
sorry.
along those lines. Yeah, yeah. If they're not breathing,
Is it
then
that?
we definitely immediately we call 911 for sure
Yeah,
and
yeah.
engage in
Okay.
CPR. But let's say they're hyperventilating. What do we do?
I mean, I would maybe if they're hyperventilating because it's a medical problem, then I would want to see what's up and if they're okay.
Mhm.
Stop the clock.
Yeah.
Yeah,
the person.
and absolutely call 911 in that situation as well. Especially if they're having a really hard time and they're not able to recover from that. Because we also don't know the reasoning behind it. It could be a heart rate issue, it could be a panic attack, it could be
Yeah.
environmental. Maybe somebody was wearing strong deodorant right beside them and they're not able to deal with that. You can always call 911. And if you're in doubt, definitely do that. It doesn't cost anything for someone to be assessed by a paramedic. If they don't get in the ambulance and get taken to the hospital, there is no fee. So you can always have the paramedics come. Any facility that you're training in or teaching in that has a pool has emergency responders. So lifeguards are emergency responders. It's part of the requirements for their certifications. So keep that in mind as well. You might call 911 and at the same time, you might call a code or have someone call a code or go down to the pool deck and get an emergency responder for the interim. Because as we know, ambulances can take quite a while to get to people. Now, can exercise and lifestyle changes help reverse type 1 diabetes? So insulin dependent diabetes?
No,
One.
not really.
Nope. Not really, exactly. Yeah. So it's not a be all end all. You're absolutely right. It's not a definite no, but certainly not in the ways that it can help with type 2 diabetes. Can exercise and lifestyle changes help reverse type 2 diabetes?
Yeah.
Yeah, absolutely it can. Yeah, and pre-diabetes as well. Yep. Which is great news for a lot of people. There's a lot of people living with pre-diabetes who don't even know it, right?
Amount of
Go ahead.
the amount of sugars and just excessive fats and yeah, it's a no wonder.
Oh, right.
It's
It's
garbage.
really no wonder. Yeah.
It's seriously like the food in the grocery stores, a lot of times it's actual garbage, yet they charge an astronomical amount for it. It's
Yep.
crazy.
Yeah, we're microdosing poison a lot of the time at this point. That I actually did a talk today that we talked quite a bit about nutrition and hyper palatable foods. Like, so we've changed our palate to think that things like Doritos are how things should taste, and that's not.
Yeah.
And of course, our brain lights up. So we've been manipulated into wanting these things, and it's a very interesting. Yeah. So as much as you can get people back to eating whole foods, that's ideal. And it's not that hard to decrease sugar in our diet when we're eating whole foods, right? Yeah. It's an
You just said,
interesting
did you say microdosing poison?
basically, yeah. That's what
I've
we're
read
Yeah,
doing.
that actually.
Hyper
That's what I'm gonna
processed
tell
food.
people when they
Yeah.
they eat a
I
bunch of junk food.
Yep. Yep.
I watched a TED talk and this woman, I think she was some sort of doctor,
Mhm.
and she basically she uh said cocaine and sugar same and
Reaction in the
from
brain. Yep.
yeah, so
Mhm.
like from a psychology point of view, I watched it from that point of view, but it's also from a nutritional point of view. Imagine what
Yeah.
that's doing to you. You're
It's
Isn't
the same
that
thing in your
interesting?
brain.
Right. And that's the tricky thing too, is that our brains and bodies are designed to crave sugar, fat, and salt because that's how we survive the winters, right? And now they're just in everything. But yeah, the more people can gravitate toward the natural stuff, the better for sure. And we really don't need that much sugar or salt in our diet. Like things don't taste that different when you just substitute with spices and good things like that, right? Yeah.
Mrs. Dash for people who can't eat salt.
Oh, I love that. Yeah, that's a really good point. Great recommendation. Thanks for that, Ocean.
Thank
Um,
you.
now, is weight-bearing exercise advised or contraindicated for people with osteoporosis?
Advised.
Advised, absolutely. Yeah, it's advised for pretty much everybody. Is dementia a normal part of aging?
No.
Nope. No, it is not. Does not have to be. Great. Yeah, great answers, guys. Now, the following acronyms. Let's see if we can figure these out. MHR, what does that stand for?
Max heart rate.
Max heart rate, fantastic. And what about RHR?
Resting.
Resting heart
Resting
rate,
heart rate.
amazing. HRR?
What's that one? I was looking at it today.
Yeah,
Something.
that's the tricky one. This one is heart rate reserve.
Oh,
Oh,
the
Yeah,
reserve.
I know, right? Yes. Now, what is the age predicted formula to find max heart rate?
220.
Minus your age.
Minus your age. Exactly. Fantastic. What does THR stand for?
Target
Yeah,
heart rate.
target heart rate. Exactly. Yeah.
Sorry,
How
my brain is shutting down. Oh my gosh.
No, that's all right. It is
Wiggle
later in the evening too, so don't worry at all. You're still doing awesome. How
Oh.
is THR measured? What unit of measurement do we use?
What? Oh,
Same
beats per minute.
beats per minute, exactly. Same as we use to check a pulse. Yeah, fantastic. Great. Now, Cindy is 50 years old and wants to work at 70% intensity. What BPM does that work out to? If you guys can make a quick calculation, if you have a calculator or phone available to you, we would do 220 minus her age. And then from that number, we can multiply by 0.7 or by 70%, whichever is preferable to you.
119.
119. Fantastic. Yeah, great job, guys. Excellent.
Fastest thumbs in the West.
Right. Yeah, great.
I was like,
Yeah, I will mention there might be one or two questions on the exam that do require a calculation like this. Okay. You are
Can we
not
bring our
able- What's that?
can we bring a calculator or do we-
Yes, please do bring a
Okay.
calculator. I've got that on the last slide as well. I won't require you to do mental math, especially first thing on Saturday morning. But yes, do bring a calculator because you will not be able to use your phone during the exam. Okay.
you get
Oh, I
one
don't
at
have a
Dollarama
calculator.
still.
Yeah, they've got calculators at Dollarama for sure.
I
I
only
haven't bought
have
a, I know, I haven't bought a calculator since probably high
I
school.
know. Same. Yeah, same.
Yeah.
But they
So-
definitely
Please
have
don't
them at
make
the
me buy a
Dollarama.
calculator for this test.
Yeah.
Like
And
I would
well,
only
then you'll
ever
have
use it for this test.
Yeah, you will probably only ever use it for this
Well,
test.
You'll
I might
probably
see
want
if I
to
can get
really
out
use it in your
tomorrow.
job.
Yeah, right. I'll see if I can get out tomorrow and maybe find a couple of calculators for us to use because I know that I'll bring them to exams in the future. So I'll make it to the dollar store and see what I can find for sure. Now, yes, you guys got that answer right. Well done. Yeah. What are the target heart rate training zones? So let's start at the heart healthy zone. Can anyone remember what percentage of your max HR that should be?
50.
Yeah, exactly. Yeah, 50 to 60%. And then next, which do we have? It's like your metabolic training zone. So we're managing,
Aerobic? Is it the air?
not quite, you're close. That's the next one. This one is weight management. So metabolic training is when your heart rate is at about 110 to 120, and that's for almost everybody. 110 to 120 is metabolic training weight management zone. We call it weight management. It's really body composition management. So you're increasing muscle mass, you're decreasing fat mass. And then absolutely correct, we are in the aerobic zone, 70 to 80% of your max HR. What comes after that? What's the next level of intensity?
Anaerobic?
Anaerobic, yes. Can anyone remember what our heart rate would be there? Percentage?
80 to 90?
80 to 90% of max HR. Fantastic. And then that last one, does anyone remember? If you remember the color, it might be a little easier.
Like dark red.
This
Is that
one
gonna
is
be on the
red.
exam?
Very red.
100% dark red.
And exactly, yes, you're right about that though. This is our red line zone. So 90 to 100% of our max HR. What zone should most beginners be working in?
Heart healthy.
Heart healthy, and then working toward the weight management zone. Yep. And then maybe eventually to aerobic once they're a little more physically fit.
A lot of people tend to really want to go straight into the weight management zone.
Yes.
They're like, oh, I don't like how I look. I need to, but you really want them to get started at the beginning.
Exactly, exactly. And that's a good time to have a conversation about functionality and safety. And also, like I remind all of my clients, we are not training for aesthetic. Aesthetic is the icing on the cake that will come on its own when you're training for functionality and strength and body composition. So don't focus on the aesthetic, focus on how you feel. And then the look part is going to come later on. And that's the great time to have the conversation, let them know they're going to be safer and they're going to get better, more consistent results if they start at the beginning. And then give them the tools to do that. Because often people who are very new to exercise are going to feel possibly like they're exerting themselves quite a bit in the heart healthy zone. So that might feel like the weight management zone to them at first as well.
True. Yeah, that's true.
Now, the components of a fitness class, what do we start with? Beginning of every fitness class, what are we doing?
Warm up.
What's that?
Warm up.
Warm up. Absolutely, yes. And what comes after that?
Cardio.
Cardio. Yeah. What's after cardio?
Cardio cool down.
Cardio cool down. That's one that a lot of people tend to forget. So great memory on you. What's after our cardio cool down?
Strength training.
Strength training. Yes. And then we finish with what?
Cool down.
Cool down, which can also be called flexibility and relaxation. Absolutely. Yeah. What are some of the benefits of a warm up?
Preparing the body for the workout.
Preparing the body for the workout, exactly. Increasing heart rate gives us joint lubrication. Synovial fluid starts to work the way it should. It warms up the muscles. Yes, and gets us into our bodies for sure, that mind-body connection. So for an older adult class, should the warm-up be longer or shorter than a standard fitness class?
Longer.
Longer, absolutely. Any idea about how long that should be for a 60-minute class?
10 to 15 minutes.
Absolutely, yes. Fantastic. What type of stretching is appropriate to be done in the warm-up? We have the two types are static and dynamic. Which one do we do at the beginning?
Dynamic.
Dynamic, exactly, yes. When is it appropriate? And we always do static stretching only at the end of the workout. Dynamic can be done at any time. When is an appropriate time to check intensity in the cardio section of class? If you were only to do it one time during the cardio section, when would that ideal time be? Be around the middle. Around the middle. So we've already gotten them warmed up in their cardio and we're not quite to the cool down. So right around midway through, if you just want to check it once, then absolutely do it then. Yeah, great. Now, in what ways can you monitor intensity during cardio? What are the two ways that we use the most frequently with our group fitness classes?
Heart rate and RPE.
RPE and not heart rate. We're not going to have them take their pulse. But what's the other one we can do?
The talk test?
Talk test.
Talk test. Exactly. Yes, fantastic. So the modified Borg scale is the RPE scale. Those are the same thing, just two words, two terms for the same thing. And then our talk test. And if you want to be doing pulse checks with your participant, absolutely feel free to do so. Definitely recommend that if you're working one-on-one with participants, even take blood pressure for sure. But just consider that most people might not be able to find their pulse quickly during a class, okay? So the talk test and the RPE scale are what we're going for. Yeah. Now, what about THR? Our target heart rate. Are we going to use that with our participants, that specific number based on their age and that calculation? Are we going to tell them, well, you want your heart rate to be here? kind of a maybe situation, right?
Yeah.
So, yeah, if you're one-on-one, and especially if your client is wearing a device that can accurately track their heart rate, for sure. Yeah, absolutely. But consider that it might be a challenge to find a pulse. And the longer it takes to find the pulse, the more the pulse is going to increase. So we're not going to get an accurate reading if we take more than a few seconds to find it. So can be very useful if you have the devices in place to check it immediately. And also considering that for people on medication like beta blockers, is target heart rate or rate of perceived exertion better for monitoring their intensity?
RPE.
Mhm. Absolutely the RPE scale, because those medications might throw off the numbers. Now, how many beats are in one measure of music? I'll say there's, oh, you're close. There is
Eight.
four
Four.
measures.
4 measures, 8 beats.
Oh, no,
Or-
4 measures and a 32 count.
That's it. That's what I was saying.
Yes, 4 measures and a 32 count. So how many beats are in one measure?
8.
8. Exactly. Yeah. Fantastic.
That's
You
yeah.
got it. I know it's so many fours and fours and fours. Yes. But the one measure is 8 and there's 4 per 32. Yeah. What is the maximum decibel level that the music in a class should be played at?
85.
85. And this is disregarding the level of your voice. So if you're doing only visual cues and using the music, that's the highest it should be.
I just hate this question. It's so unfair.
I know what you mean. Yeah. And I will mention that to the people in charge of creating the exams, that
Because
might
I
not
like the way
be.
that you worded it. We have to include the voice, right?
We do have to include the voice. Exactly. Yeah. And that being said, you can get some great apps on your phone for measuring decibel volume. And I would highly recommend, if you're not sure of the space you're working in and the acoustics, maybe try that, going closer to the speaker and further away. But yeah, you're absolutely right. That's really the maximum level of sound that we want in the room, including your
Sound.
voice.
Ooh, that's a yeah, you
Yeah.
should use sound. That's a
Yeah.
great substitute for the word
Yeah,
music.
no, I agree with that. I'll mention that to them, but so that you know, when we're looking at maximum decibels of music, it's 85 for these purposes.
Right. Sound would be, because what if the acoustics were like whack, more
Yeah,
intense, because that would add to the decibels.
absolutely. And you might have 85 decibels in one corner of the room, and then everywhere else is 10 or 15 less than that. So you want to go with wherever it's loudest also. So that's yeah.
Oh,
Yeah. So
okay.
that's, yeah, I would check around the room. And that's another reason that I'll tell my participants, like, let me know if I'm too loud or too quiet, or the music is too loud or too quiet, because I can't hear what's happening in every part of the room. And
Right.
depending on where
Yeah.
speakers are located, it is gonna change for sure. Now, to be heard over the music, how many decibels more does your voice have to be?
10.
10. Fantastic. Yes. What are some of the primary reasons to use music in class?
Fun. Make it upbeat.
It's upbeat. It's fun. Yeah. Yep. Absolutely. All of that stuff.
So
And
you don't have to count.
so
It
you
keeps
don't
the
have to
instructor
count.
on
Yes, that
beat.
is on here.
Yeah,
Ease
it's true. Yeah.
counting, motivation, knowing our spot in our choreography or our lesson plan is a good one as well. And of course, that fun factor and helping participants through the movement. Great. For those living in larger bodies, what are some of the challenges they might have with exercising?
The bigger bodies tend to have more pressure on their joints and things.
Yeah. hmm
That can make things difficult when it comes to exercising. They would have to alter and modify depending on where that pain is.
hmm Absolutely. Yes, that is a great point. So definitely there's more stress on the joints. We also want to consider that they might get tired a little bit more easily. They might overheat more easily. So their thermoregulation might not quite be the same. And also considering just the mass that they're working with. They might not have the same range of motion because of the bulk of the body. Now, people with diabetes are 2 to 4 times more likely to develop cardiovascular disease. Is this true or false?
True.
True. Absolutely it is. Yep. Exercise is important for older adults because it helps to do what?
Socialize.
What's that?
Keep them social.
Keep them
Keep them
social.
active.
Absolutely. Yeah. And that comes along with, that's hand in hand with quality of life for sure. Yeah. And we're training for functional strength, but why?
So that they can do their ADLs.
Yes, absolutely. Activities of daily living, fantastic. It also helps to retain independence as well. And like you said, that social aspect, Ocean, I'd love it if that was more specific here. But yeah, the social aspect is a really big one because we know that loneliness shortens lifespan and it gets more challenging to be social as you get older and have more restrictions. Oops. So now the common components of aging, all right? So we have the age that is the number. What is that called?
Oh, your chronological age?
Chronological or biological age? Yes, absolutely. And then what about the age that we are mentally? Like how we feel in our heads. Is that? You're close. It starts with a P and the P is silent. It's it's a very tricky question.
Oh,
Yes,
yeah,
psychological age. Yes, absolutely. And then what about in our social groups in our community?
Marvin, stop. So,
This is a tricky one.
I keep thinking chronological age, but
That would be the same as biological age. That's our chronological, the official number. This last one is our sociological age. Yeah. So in our social groups and in our
social.
learning and things like that as well. Yeah. What are some of the things you should consider if you apply the principle of exercise arrangement? So let's say, for example, the order in which you're going to exercise the muscles based on their size. What should we consider there?
Big muscles first.
Yes, absolutely. Big muscles first. And then what about using multiple joints or individual joints? Which one of those do we do first?
Multiple.
Yes, multi-joint before single joint. And then are we going to do a heap of different exercises, sets and reps for the same muscle group? All over. Yeah, no, we're going to switch things up. Exactly. So no two successive exercises should involve the same muscle group. In general, sometimes if I'm teaching a class and we're doing 3 sets for biceps, for example, we might do 3 different exercises for those 3 sets. So if it's in line with the number of sets and reps that you're teaching, you can switch up your exercises for the same muscle group, but we don't want to be doing that again and again and again and neglecting our other areas. Now, for progressing older adult fitness levels, a safe percentage is what percentage of progression weekly?
5 to 10, I think.
Very close, a little less than that. So, oh no, you know what? You're absolutely right. I was looking at 2 to 5, but you are correct. It is 5 to 10%. Yes. Now, which of these are parts of the seniors fitness test? Oh, sorry. The answers are here. Neck scratch, arm curl, chair stand, or B and C only.
So that
B and C.
Yes, absolutely.
Cheers.
Yeah. And the neck scratch test is tricky because it's actually the back scratch test is the other name for that.
it's
Yeah.
the
Yes, exactly. Yeah. Which of these use 14 different tests for balance? It is the Borg scale, the Berg balance scale, the Fullerton advanced balance test, or the senior fitness test?
Is that the Fullerton?
Nope.
Berg.
Berg. Yeah, this one's tricky because Berg and Borg are so similar. So that one gets confused in my head, but it's the Berg that uses 14 different tests. And if you guys remember what the Borg scale is, that's the one that we modify for rate of perceived exertion. So the modified Borg scale is RPE. Burger, exactly, yes. This balance testing uses 10 tests for both dynamic and static balance to measure balance in higher functioning active older adults. Is it, oh, hang on. Yes. Is it the Borg scale, the Berg balance scale, the Fullerton advanced balance test, or the seniors fitness test? Fullerton, absolutely, you're right. Fantastic. Now, which type of stretching is better for helping to lower the risk of falls? PNF stretching, so proprioceptive neuromuscular facilitative stretching, is when someone comes into an extension. Let's say they're laying on their back, their leg is up in the air for a hamstring stretch. You hold the leg in place, they contract the muscles against your hand, And then when they relax, you move it further. That's an example of PNF stretching, okay? And then we have dynamic stretching, which is stretching and moving, static stretching, which is stretching and holding, and ballistic stretching, which is stretching and bouncing in the movement, which right, exactly. Yeah. Which
No
one?
ballistic,
Hmm?
not ballistic.
Not ballistic.
Dynamic
No.
stretching, maybe?
Dynamic stretching. Absolutely. Yes. Great answer. So static stretching, just an FYI for you guys, will temporarily weaken the muscles. When we hold a stretch for 15 seconds or longer, those muscles do get weaker, which is why we don't do it at the beginning of a class. And also why it's not super great for helping to lower the risk of falls, because it will increase their flexibility, but temporarily weakened muscles could actually increase the risk of fall. Yeah. So with dynamic stretching, we lubricate the joints, we warm up the body and bring in that proprioceptive awareness. Now, kyphosis is a C-shaped curvature in which of the following regions of the spine? Is it cervical, lumbar, or thoracic?
Thoracic.
Thoracic, you are absolutely right. Lordosis is an inward curvature of the lumbar spine. True or false?
Yes.
Mhm. True. Yes, absolutely. And also keeping in mind what we can do for lordosis. So are sit-ups and the cat stretch recommended for lordosis?
No.
No, they are not. And that's a pretty easy answer because we don't really recommend sit-ups for anything. We find alternative exercises for that, for sure. All right, that is actually everything for this evening. Thank you so much again for your time and attention, guys. I know it's challenging to get the brain going this time of night, but you guys did absolutely awesome. I know you're going to really do well on the exam. I think that both of you guys are planning to write the exam on the in-person day at 9 a.m. to 10 a.m. If that changes for you, please do let me know. Keep in mind too, no stress because you also have two chances. So if it's too much pressure, exam anxiety is certainly a thing. If you have trouble on the in-person day and you need to write it again later, we can book online for your proctor to be available when it's convenient for you. Here is the information for our in-person day. So we will be at the NSCC Ivany campus. That's at 80 Mauiomi Place here in Dartmouth. And when we get there, when you drive into the campus, you're going to go all the way past the buildings, all the way down to the bottom of the campus. And we are going to be the last building on the left-hand side. So it's a great
Not
big
the high
building.
school. We're
Not
not
the
going
high
towards
school.
the high school. We're going right. Okay, because
Yeah.
I always go into the high school by accident.
Oh, okay, yeah. So
Not
just
going
take it
that way.
straight down. Yeah, so it's 80
Okay.
Mauiomi Place. If you Google map it, it'll take you right there. It's across from the hospital. The campus is a fairly good size. There's several buildings, but if you drive straight down, you're going to see a parking lot on the right next to the water. You'll see the water right in front of you. And then the building we're in is on the left-hand side. And we'll be on the 5th floor. It's room 5321 for the exam from 9 to 10 and room 5110 for the remainder of the day. Go ahead, Ocean. Yeah.
Oh, I just wanted to say, because the last time I was there, I had a hard time finding parking, but you can park anywhere,
You
even
can
in the
park
staff.
anywhere. Yes.
Yeah.
So on a Saturday, usually campus is closed. Even if it's not closed, you can park literally anywhere. I have a tendency to park on the right-hand side because that's just where the big lot is that's closest to our building. And again, you'll see the water right there. So it's and I'll send you these instructions in an email as well. If I will not be able to answer phone calls between 9 a.m. and 10 a.m. If you do happen to show up late, but I will be able to answer texts intermittently, and there will also be security right inside the main doors who can take you right up to the classroom. Okay. Yeah, parking is free on the weekends, so pretty much wherever you want. Our exam starts at 9 a.m. So if possible, let's meet in the lobby at 5 or 10 minutes to 9. Right at 9 o'clock, I'll be heading up to the classroom with whoever's there. If we can get there a little early, that's ideal. Bring a pen or pencils. You can use either on your answer key for the exam. Manual calculator, which I will make it a point to pick up tomorrow. So we've got a couple. After the exam, the practical portion is going to begin at around 10 o'clock. So we'll be heading right next door to the exam room into the fitness room. Please do bring snacks, lunch, hydration, and the mat. There will be mats available there if you don't have one. But do feel free to snack throughout the day while we're doing our course because there is going to be a lot of movement involved. The closest, oh, go ahead, Ocean. Yeah. Mhm.
Oh, no, I just, so SMU has a football game on Saturday that I'm supposed to
Oh.
work at.
Oh, really?
Do you know if we're gonna
Okay.
do the whole entire 5 o'clock? Are we going straight to 5?
Because it's such a small group, we will likely finish up a little early. And I'll say too, like you just finished the GEL certification, didn't you? I think that was. Yeah, okay.
Uh,
A lot of those components are very much applicable to the ADE certification. So if you did happen to have to step out a little bit early, I'm sure you would still be fine. But yes, I mean, we might go for the whole day. It's unlikely because there's only going to be 3 of us there, so it'll take fairly less time. But yeah, we can chat about that more, and we'll make sure that we get like the really heavy components done at the beginning of the day, just in case you have to step out as well. So
thank you.
yeah,
Sorry, I'm just
absolutely.
curious.
That's
Said it's
fine.
a
Don't make
football
it
game?
happen. Mhm.
Pardon?
You said it was a football game, you said?
Yeah, yeah.
I don't I don't normally watch sports, but I thought I would eventually go to like a university sports
Yeah.
thing.
Oh, well, if you want to go, come with me. I work at them. So you can just like you can literally come and be a water girl if you want.
Oh my God, I love that. I would
That's so
own
great.
that. And yeah.
That's
Did
awesome.
you just say I
love
would
that.
own that? That's awesome.
That's so great. Best
And we're
water girl
number one in
ever.
the league right now too, so it's kind of exciting. And
Oh,
I've been to every single home game. This will be the first one that I don't get to go to, and it's kind of like I don't want to say it's going to be bad luck. I hope it's not going to be bad luck.
no, of course not.
Knock
No.
on. Yeah, I knocked on my wood for you.
Yeah.
I
Knock on wood.
appreciate that. Thank you.
That's great.
Sorry, didn't mean to take time with that. I was just curious.
Oh yeah, for sure. Yeah. Yeah, we can try and work around that for sure. And I love to hear that you're supporting our local teams because that's such an important
Thank
thing to
you.
be doing for
Go
sure.
sports.
Yes,
Yeah.
go sports. Yay. Great.
Get them while they're young. They'll keep them
Yeah,
when they're at this age group, right?
Exactly.
absolutely. Yeah. I will mention that the closest option for food tends to be fast food near this area. So Tim Hortons is like a 5-minute drive away, but that might not be what you want. So I would highly encourage you guys to just bring some whole foods that are more comfortable for your system. And of course, wear gym clothes and please do bring indoor gym shoes. I'm a big advocate for barefoot training, but just be aware that there is a slip risk if we're wearing socks. So preferably indoor shoes available. Whether or not you choose to use them is up to you.
Guys
And
like oranges because I have oranges that in the next few days need to be used up. So I'll bring the oranges with me on Saturday.
yes, absolutely do. And the smell of oranges lights up our brains too and
Right? I
wakes us
love
up. Yeah, I love that. That's awesome.
I'll give you all the oranges.
Amazing. Do you have something to
In the
say?
beginning, your cat like just I bawled my eyes out seeing your cat.
Oh,
Your cat's adorable. Now I'm
Oh,
laughing. So thank you guys for making me laugh. I really appreciate
absolutely. Yeah. And
yeah.
thanks for doing this with us, Ocean. I know that sometimes it can be challenging, but you've like come out of yourself and yeah, got that focus in there. So yeah, I hope everything's going okay for you. Yeah, and that it continues to. It's never easy for sure. I still have a photo of my doggo on my phone. I don't know if you can see that. That was Toby, my sweet pupper, and he passed away probably about 5 years ago, but is still always in my thoughts. And I really try to find that solace in positive memories is really what you got to do sometimes. So yeah, take care of yourself and keep me posted about Saturday too. Let me know what that looks like for you, and I will anticipate seeing both of you at 10 to 9 unless otherwise stated on Saturday morning at the NSCC. All
I
right.
will be there with Elsa
All right, awesome. All right, and oranges, yay.
and oranges.
All right, you guys have a great night. Get some
You
rest.
too.
We'll see you
Thank you.
soon.
See you
Thank you
Saturday.
guys.
Thank
Don't blow
you.
away
Take care.
tomorrow.
Yeah, right.
Yeah.
You too. Happy Halloween. I hope you guys
Yeah.
enjoy.
Happy Halloween.
All right.
Bye.
Bye,
Thanks,
guys. Bye.
guys. Bye.